Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore the diagnosis of leukemia and the tests involved, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Leukemia is diagnosed through a series of tests, often initiated due to symptoms that a patient may be experiencing or abnormal findings during routine blood work. These tests are critical for accurate diagnosis, determining the type and stage of leukemia, and formulating a treatment plan. Physical examination is the first step in the diagnostic process. This allows doctors to check for physical signs of leukemia, such as pale skin from anemia, swelling of the lymph nodes, and enlargement of the liver and spleen. Blood tests, specifically a complete blood count, CBC, can show if there are too many white blood cells, not enough red blood cells or platelets, common signs of leukemia. If the blood test results suggest leukemia, the next step is typically a bone marrow test. This involves removing a small amount of bone marrow, usually from the hip, and examining it under a microscope to look for leukemia cells. Flow cytometry is another vital test used to diagnose leukemia. This technique is used to measure the number of cells in a sample and their characteristics, which can help distinguish between different types of leukemia. Immunohistochemistry, a laboratory method used on bone marrow or other tissue samples, uses antibodies to identify specific types of cells based on certain proteins they contain. Cytogenetic testing analyzes the chromosomes in cells to find changes that can affect the prognosis and guide treatment. This may include a technique known as fluorescent in situ hybridization, FISH, or polymerase chain reaction, PCR. Molecular testing can be used to identify certain gene mutations that may drive the growth of leukemia cells, and can help guide treatment decisions. A lumbar puncture, or spinal tap, might be performed to check if the disease has spread to the spinal fluid, which surrounds the brain and spinal cord. Imaging tests like a chest X-ray, CT scan, MRI, or ultrasound might be done to check if leukemia cells have spread to other parts of the body such as the lungs, heart, or kidneys. Lastly, a biopsy of swollen lymph nodes or other affected areas might be performed to check for the presence of leukemia cells. In summary, leukemia diagnosis is a comprehensive process that starts with a physical examination and may include blood tests, bone marrow tests, flow cytometry, immunohistochemistry, cytogenetic testing, molecular testing, lumbar puncture, imaging tests, and biopsies. Each of these tests provides critical information that contributes to an accurate diagnosis, enabling doctors to design the most effective treatment plan. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.